Hello everyone, welcome to Dr. Behind Lens. I'm Dr. Noindopani, and today we'll be talking about liver function test. While discussing liver function test, our prime focus will be on the enzymes, and at the end of the video we'll also be discussing some of the clinical case scenarios, so try to stay till the end. So when we talk about the enzymes, so there are basically four enzymes that are important when we in the case of liver function test. The first one being alanine aminotransferase, second one being aspartate aminotransferase, there is alkaline phosphatase, and there is gamma glutamyl transferase or gamma GGT. So when we talk about alanine aminotransferase, it was also previously known as SGPT, whereas aspartate aminotransferase was known as SGO2. But this term are obsolete and is not used now, but it's better to get used to this kind of word. So let's dive in to a little bit deeper what this enzyme represent and what are their function. So let's assume this is a liver. Please pardon my very bad drawing. So this is a liver. We have the right lobe of liver. This is the left lobe of liver. From the right lobe of liver, there is right hepatic duct. From left lobe of liver, there is left hepatic duct. From when right and left lobe of hepatic duct combines together, they form common hepatic duct. When common hepatic duct is joined by cystic duct, then it forms something known as common bile duct. So basically, for the academic purpose, for learning purpose, liver can be divided into two parts, that is the liver parenchyma and the biliary system. Okay, so when there is any disease process involving the liver parenchyma or any pathology associated with liver parenchyma, such as liver cirrhosis or viral hepatitis or any other condition, non-alcoholic fatty liver disease, then there is rise in the level of ALT and AST. So as we discussed before, there is rise in the level of alanine aminotransferase and aspartate aminotransferase. Similarly, when there is any disease process involving the biliary system, then there is rise in the level of ALP or alkaline phosphatase and gamma glutamyl transferase or gamma GGT. So this is the first concept that you need to keep in your mind. When there is any disease involving the liver parenchyma, there is rise in the level of AST and ALT, whereas when there is any disease involving the biliary system, that is common bile duct or common hepatic duct, cystic duct or right and left hepatic duct, then we'll have rise in the level of ALP and gamma glutamyl transferase. So let's dive a little bit deeper into the topic. So when we talk about alanine aminotransferase and aspartate aminotransferase, the first question that pops in our mind is which is more specific, that is important for academic purpose as well as for the clinical purpose as well. So the answer behind it lies in the synthesis, site of synthesis. Alanine aminotransferase and aspartate aminotransferase both are synthesized in liver. Okay, so both AST and ALT are synthesized in liver, but apart from that, AST is also synthesized in the case of skeletal muscle. They are also synthesized in skeletal muscle and heart. So what basically happens is, since it is synthesized in other area as well, also in the not just in the liver but also in the skeletal muscle and heart, but ALT is synthesized only in the liver, so this makes ALT more specific for hepatic diseases. Okay, so AST can also rise in other non-hepatic diseases like rhabdomyolysis, or in which there is the rupture, there is the breakdown of the muscle cell. It can also rise in disease involving the heart, such as MI. So it can also rise in the case of MI and something known as rhabdomyolysis. Yes. But ALT is generally raised only in the case of liver diseases. So that is the first answer. So ALT is considered to be more specific than AST when it comes to diagnosis of the liver pathology. So that is the main important concept. So what the other thing that we all need to know about AST and ALT is that in normal liver, ALT is always greater than AST. The level of ALT is always greater than AST. The reason behind it is that AST is more rapidly cleared by So it is more rapidly cleared by reticuloendothelial system. Rapidly cleared. So that is done by reticuloendothelial system. So that is the reason why ALT is always greater than AST. But similarly in the disease condition as well, when there is cirrhosis or due to any other causes, then there is always, the rise is always greater in the case of ALT than AST. But there is one exception to it. The exception is alcoholic liver disease, which is also the most common cause of cirrhosis. What happens in alcoholic liver disease is, try to understand this concept very clearly. So in alcoholic liver disease, the enzyme that is responsible for the synthesis of alanine aminotransferase or ALT. So for the synthesis of ALT, there is one enzyme that is very much essential, that is known as pyridoxal phosphate. Okay, so pyridoxal phosphate. So this enzyme is necessary for the synthesis of alanine aminotransferase. But in the case of alcoholics, so this enzyme is deficient. So since the enzyme is deficient in the case of alcoholic, so in the case of alcoholic liver disease, ALT is less than AST. In fact, we do have a ratio for that. The ratio is that when AST is to ALT ratio, when AST is to ALT ratio, when it acts more than 2:1, then what do we have? We call it alcoholic liver disease. So exception to the rule that ALT is always greater than AST is broken in the case of alcoholic liver disease, where AST is greater than ALT. So this is a very important question and also a very important concept for clinical judgment as well. So after ALT and AST, we will discuss a little bit about the other enzyme that is known as alkaline phosphatase. So alkaline phosphatase, as we discussed it before, so it is usually raised in the case of biliary system pathology. So alkaline phosphatase is an enzyme which is also synthesized not only by liver but also by other important structures such as bone and placenta. So as we know, since it is synthesized by not just liver but bone and placenta, it makes it less specific like AST. Okay, so not just that, alkaline phosphatase level also tends to rise in the case of physiological condition. There are different physiological conditions in which alkaline phosphatase rises. So as we know, it is synthesized by placenta. Naturally, it rises during pregnancy. See, similarly, in the time when there is high bone turnover, such as adolescent period. So during adolescent period or even in the elderly people, so there is physiological rise in the level of alkaline phosphatase or ALP. But one important concept to be known, to keep in mind, is that the physiological rise is always less than 4-folds. Okay, so when the rise is more than 4-fold, it is always pathological. But once it is pathological, we have to always keep in mind that there are different things that may be involved. There may be osteoblastic bone lesions, there may be the liver pathology as well. So this is less specific when it comes to determining the liver disease. So after alkaline phosphatase, other enzyme that is usually raised when there is disease of biliary apparatus is gamma glutamyl transferase. So gamma glutamyl transferase, so gamma GGT. So gamma GGT is more specific for liver disease. For liver diseases. Okay, so gamma glutamyl transferase is more specific for liver disease when it comes to liver function test. So there is a case. So we have a patient whose hemoglobin level is 6 mg per dl. The total bilirubin is raised, and we have something known as unconjugated bilirubin is more raised than conjugated bilirubin. So conjugated bilirubin is also raised, but unconjugated bilirubin is more raised. So everything else is fine. That is, the liver function test is completely fine. So what may be the condition? So first thing that needs to come in your head is that there is anemia. Okay, so first thing is there is anemia. So there is anemia, and there is also increase in the level of unconjugated bilirubin. So similar, this type of condition occurs when there is increased rupture of RBC. Okay, so when there is increased rupture of RBC, as it occurs in hemolytic anemia. So as it occurs in hemolytic anemia, the similar kind of picture is seen. That is, decrease in hemoglobin level, increase in unconjugated bilirubin, and increase in the level of total bilirubin level, but everything else is fine. So this is also known as the pre-hepatic jaundice. Since bilirubin level is raised, there is pre-hepatic jaundice. Pre-hepatic because the cause of jaundice is pre-hepatic, that is in the blood cell. Hemolysis of the blood cell is the cause of jaundice. And the next scenario, there's increase in the level of AST, there's increase in the level of ALT, total serum bilirubin has raised, alkaline phosphatase is slightly raised or it is normal, and patient has jaundice. So what may be the condition? Since there is a rise in the level of AST and ALT, there is definitely liver pathology. So total serum bilirubin has also rise, so there is jaundice, and alkaline phosphatase level is normal. So this accounts for something known as hepatocellular jaundice. Hepatocellular jaundice because there is a raise in the level of AST and ALT. Okay, so ALP is finely normal or slightly raised. This is very important concept to be taken care of. So in the next scenario, we have AST that is rise, ALP that is rise, AST that is rise, ALT that is rise, but more important, alkaline phosphatase and gamma glutamyl transferase is more prominently rise, and patient has jaundice. So as we know, it is always associated with biliary apparatus. So biliary apparatus, since it is associated with biliary apparatus, it has to do something with the biliary tract or common bile duct. So that is known as obstructive jaundice. In obstructive jaundice, one important concept that is to be known is that there is increase in the level of conjugated bilirubin. Okay, so conjugated bilirubin level rises in the case of obstructive jaundice. That can be due to anything such as stone, it can be due to polyp, or it can be due to carcinomatous changes. So anything can be in the reason which can give rise to obstructive jaundice. So that's pretty much everything. When we talk about liver function test, you can also get the note of this topic. I will try to provide it in the Facebook page. So if you have any queries regarding liver function test, then please feel free to comment in comment section, and if possible, please like, subscribe, and share. Thank you.